necrotizing enterocolitis. So this is a question that is, the questions that come from this topic are usually very easy, but recognizing necrotizing enterocolitis requires very specific information in the question. Usually it's a neonate, and they're going to present with three things: prematurity, a low birth weight, like less than 1.5 kilograms, and enteral feeds. So those three things should prompt you to think about necrotizing enterocolitis as a possibility. Now, these congenital problems can present with other congenital problems as well. So that's just a little bit of history in the question. So these three things the questions are going to come from: what are you going to do next? Or what are the complications? Or what are you going to see in the next diagnostic step? So the first step would be a chest x-ray. So the x-ray will classically show for necrotizing enterocolitis pneumatosis intestinalis, which is air within the bowel wall. And it will also show pneumoperitoneum, which is air in the peritoneum, basically underneath the diaphragm. So free air under the diaphragm, pneumoperitoneum, and air within the wall, which is pneumatosis intestinalis. And then the question would be, what are the complications? Because of so much invasion of the gut by bacteria and all the inflammation and necrosis that happens, it can cause perforations. And definitely if it's perforating into the peritoneum, you can have peritonitis. Apart from that, you have strictures within the intestinal wall, and it can cause a short bowel syndrome, disseminated intravascular coagulopathies, the respiratory distress syndrome in children, and sepsis because of all the infection. So that's it. Those are all the important points you need to know, because in terms of the symptoms, it's very non-specific. Whether it's a bloody stool, unstable vitals, feeding intolerance, abdominal distension, that's not very specific, pointing towards the diagnosis. That's it.